Welcome to the Alliance Lift, the podcast that brings you closer to the people driving change in health policy and systems research around the globe. I'm your host today, Idil Sheikh Mohammed. In each episode, we explore the experiences of Alliance alumni making 3 stops along the way, learning from the past, living in the present, and leveling up for the future. Whether they're shaping policy in ministries, advancing research in universities, or as in today's episode, bringing academic inquiry with indigenous knowledge, our alumni are continuously raising critical questions, sparking action, and expanding the horizons of health policy and systems research. And now I'm honored to welcome our guest for today, Dr. Carol Zavaleta-Cortijo. Carol is a Peruvian medical doctor, health scientist, and indigenous scholar from Quechua community in Ancash. Her work centers on transforming health systems through intercultural approaches grounded in indigenous knowledge, climate resilience, and equity. Currently, Carol is affiliated with the Faculty of Public Health and Administration at the Cayetano Heredia University in Peru and co-chairs the Indigenous Peoples Observatory Network, a collective working at the intersection of food, climate, and health. She's contributed to global scientific initiative through the UN's Environmental Programme, the Food and Agriculture Organization, and Lancet Commissions, and continues to mentor the next generation of Indigenous researchers. What makes Carol's journey especially interesting is how her professional work has also been a path of her personal reflection, one that's brought her closer to her Indigenous roots and worldview. This connection is now at the heart of her work, bridging academic research with ancestral knowledge to advocate for resilience of Indigenous communities. And with that, Carol, welcome and thank you so much for joining us today. After hearing that introduction, where does your mind go first? Sort of what stands out to you the most about the path you've taken to get to where you are today?
Actually, I was thinking in the mountains because, when you're talking about the Andes and the ancestries and talking about transforming the health systems, I am thinking that most of the health systems, at least in Peru, where I am working with, has been disconnected from mountains, from lakes, from rivers, in general, from nature. For many years, I was thinking that the access to health systems, to healthcare systems, was a challenge. But actually, I was thinking is beyond that is the health system that doesn't have that. So it's not just the access, it's something internal. It's not an external situation.
Really beautiful how you think about it, it's not saying it's a lack of access to the health system. It should be the health system being integrated into the nature as you were describing it. We'll come back to this topic, but I just want us to rewind a little. This is our segment called Learning from the Past. As I said, Carol, you've walked an interesting path. You went from practicing medicine in the Amazon to sort of researching and shaping global conversations on health equity. But looking back, if you had to describe your early career in 3 words, what would they be and why?
Okay, 3 words was inspiring, challenge, and risk, I would say. Yes, about the inspiring is because when I was working in my clinical experience, as a medical doctor in the Amazon, so I learned so much from the health workers, but also from the patients, So I think how they face the difficulties and how they handle all the obstacles that they can get for accessing adult health was inspiring. I tried to help, and many times I couldn't for many reasons, especially for different culture, limited access to good quality of health services. So that was inspiration. That was hope for me. The challenge was exactly that, So try to understand the different cultures, the different way of thinking, and also understand my own country and my own thinking. My own education was a challenge because I was trying to say how I didn't know that before. So I was struggling with my own education. That was a challenge. And the risk, when I started my career, my first research and my first clinical practice was with infectious diseases. And my first publication, my very, very first, was about HIV affecting indigenous communities, hepatitis B affecting indigenous communities in the Amazon. And especially for the HIV, I felt that I was risk in some way because people in the health sector, they didn't want that I talk about that. that was something I felt that my career was in risk. So at some point, I just felt that I need to stop because I am telling something that is not appropriate. So I felt that I was in risk, not because I was navigating the rivers in the Amazon. That was very fun, was interesting, was good, was inspiring, but was about the system. To be a young researcher trying to discover new things and trying to say, oh, something is not very well here, it's not working very well. So, yeah.
Wow, that is so interesting to hear how you were trying at an early stage of your career, trying to bridge these worldviews, you coming as a clinician to these communities and wanting to research and learn more about the spread of these infections, but sort of being met with not necessarily resistance, but it was just a different way, I guess, maybe of understanding these diseases and such. So no, thank you so much for that reflection. But also when you think back, what led to the shift of your focus from clinical medicine towards health systems research more broadly? Where and how did that shift happen?
When I was working in these infectious diseases, I wanted to do something different, and I met also people who wanted to work on that in the health sector, in the Ministry of Health. And we're trying to do something like an interventions to improve the access to HIV medication or culturally appropriate treatment, and not to make some changes. There was the challenge because not the health sector, people, they didn't see the difference. So once I remember I was in an office in the capital, no, in Peru, and I say, we need differentiate data. So we need to know for ethnic differences, we need to know what's the prevalence of, for example, cancer. And they say, Carol, but cancer is everywhere, and maybe they don't have cancer. And I say, okay, yeah, but I mean, for me, it was like, maybe this is not the right place to be here, no? So I thought that something fundamental, something systemic needs to be different. Or I also challenge my own mind, no? And say, maybe I am so wrong. So this is how I switch from having been on the field, on the ground, and I trust on the system, and I went to work more on policies, especially for indigenous health. And at that moment is where I felt that situation in the national system. And at that moment, I was very lucky that I have very good mentors, and they recommend me to continue on the path and understand how the health is model shaped by other conditions. And I met these researchers from Canada that they were interested in understand the environmental determinants of health. So I say, maybe that's the other path that I can follow. And this is where I start to work with different people who are not part of the health sector, but who are from different academic backgrounds, not the health sector. And at that moment, I understood something that maybe we need to see the health system and the health research from a different perspective, from a different discipline. So this is how I got involved in other aspects of health systems.
Amazing. And in reading your bio, you share how reconnecting with your Indigenous identity on a personal level has also been a part of your professional journey as a researcher. Was there a key moment when you felt that personal path and that professional work really came together? What was it like in trying to bridge those different ways of knowing?
Yes, actually it happened while I was in Canada, far from my country and living far from my family and all the relatives. And this is because when I was writing my thesis, I realized that I wanted to give thank you to the land. I wanted to give thank you to the space where I was doing my fieldwork and everything. And I say, but my family came from the Andeans. My family came from these type of food systems. They were also my grandmother, my grandfather. They were also indigenous. And I say, okay, so I am also indigenous. So it was like, okay, so I need to use that part, because at that moment when I was writing my thesis was an intense moment, no? And I felt that my head was split in two parts. One is very structured with my thesis, and the other one was more like emotional and was more like connecting with my grandparents, no? So that was the moment where I say, no, I need to reconcile those parts to continue my path.
That's really beautiful. Thank you for sharing that. And so before we talk about what you're currently working on today, I'd love for us to spend a little bit of time talking about your connection with the Alliance. So you've been engaged with the Alliance in recent years, not only through the alumni network, of course, but also as a grantee, you've done some work on exploring how Indigenous communities and leaders have responded to climate shocks and how those responses are being articulated and adapted within health systems of Amazonian regions. Could you tell us a little bit about that research and what it was like collaborating with the Alliance?
Actually, it was like a coming back to the field. I mean, in terms of coming back to the health system, because I was working mostly on environmental aspects or social aspects mostly, and with communities. But with the Alliance, I had the opportunity to work again with health officers at the local level, the regional, the national, the international level. And that was a very nutritious experience because show me that there is opportunities to improve or to make the systems stronger if we can connect the global, the national, and the local level.
Wonderful. Thank you so much. So let's fast forward to today. This is living in the present. So how would you say your academic and professional journey has influenced the way you teach and conduct research?
I think the academic system needs to improve something that is called in the literature cultural humility. And culture is not only where you came from, it's also about the discipline, the culture and each discipline that you have. And especially in these days where we have different challenges that are not necessarily typically from one discipline. For example, for medicine, if you're talking about climate change, it's not necessarily something that has been taught before. I am also currently working on biodiversity laws, for example, and that's also critical from my point of view. For me, biodiversity is like the DNA of Earth. So we are missing the DNA of Earth. We are missing more than life, no? We're missing surviving in this planet. So how the academic system can be prepared, can be adapted to this new era, to this new multiple challenges that we are facing.
Great. And how do you ensure that insights from this research, whether it's about biodiversity loss, health, climate, food systems, how do you ensure that the findings from these research influence real-world policies, especially in settings where Indigenous knowledge might often be marginalized?
I think we need to be persistent. That's one. Also, to be aware of everyone is not in the same page. Things are happening so fast that we need to consider that we need to talk more across sectors, across disciplines, and to remain open. This is why I think that cultural humility, calm, persistence, patience is important to navigate the next probably 5-10 years in the transformation of the health system.
Yeah, and you mentioned the importance of the next generation. You've mentored Indigenous researchers, which is no small thing. What would you say has been the most meaningful or surprising part of that mentorship work?
I think this is very important. And the main surprise is that when I don't say anything, I'm just asking, what do you think, how we can do this? The ideas that coming from the Indigenous persons on the ground, it's amazing. So they have everything. And this is a surprise because I thought that maybe they would request any particular, technology, for example, to support an intervention. But no, it's basically just my presence there and the presence of the youth. I think they are enthusiastic and they have the ideas. And in this present time, it's a moment where we should embrace those new ideas, those ideas that we can think are crazy ideas. This is the opportunity. This is the right moment. And I'm learning to be a mentor that can embrace those new opportunities and the diversity of knowledges, because Indigenous peoples are diverse, are across the world. And those different ideas can support any type of intervention, from something related with biodiversity conservation through make up new business. So I think a new business and all of those can be connected with health.
Excellent. And that's a great segue into our next section, where we shift gears to the future now. It's leveling up. So, Carol, in your view, what does an inclusive and climate resilient health system look like?
I think health systems and healthcare systems are more aware that nature is important. Protect, conserve, sustain nature is important. I think with climate change, with all these planetary crises, the health systems cannot close their eyes. I mean, the practitioners can probably they cannot close their eyes to what is happening these days. And so I think at the global level, maybe there are more awareness. So the challenge now is to try to close the gap of information and action at the local level. And the local level, there are many ideas, interventions that not necessarily came from the typical health practitioners. And that's the challenge, how we can identify those interventions and with an open mind to support not only people, but also to support Earth and to support the basic elements to survive in this planet.
That's really beautiful. And you mentioned also earlier these new or crazy ideas. So what would you say, what developments in Indigenous-led research or knowledge gives you hope or feel especially important for shaping the future of health systems?
I think that from Indigenous perspective, I am using that side of my mind, the idea that, for example, food sharing. Food sharing is something that we are not practicing anymore, but this seasonal use of food and food sharing are very basic things. We have forgot that. We have forgotten that when I was a child, that was part of my family. And then when I went to the Amazon and was working with indigenous communities, they remind me about that. So for them it was very normal, but especially with those things that they don't buy. So things that they get with their own effort. So not necessarily with something that they receive money from social programs and they share that. For them, the meaningful thing was more about when I share something that I generate, that I produce. And I think basic values like food sharing, like, for example, caring for animals, how the indigenous peoples or the indigenous families, they care for animals in a different way, how the global society these days care for animals, no, when they are looking at the food system. So I think those are examples of indigenous values that we can introduce in the health systems and the health policy research.
Thank you so much. And finally, what advice would you offer young scholars or health workers who want to lead impact research, policy change in their own communities?
I think is to believe in yourself, because at this moment with the technology and with the access of information, you have the power to do a meaningful changing in your local level and the national level or where you are. I think it's important to tell this to the next generation and to the practitioners. We need to believe in ourselves and the power that we can actually change the system.
Wonderful. Carol, thank you so much. Your story and the way you carry it is really inspiring. I think you've shown that how research, identity, advocacy can come together, not only to transform systems, but these relationships that we have and also these basic values that you touched upon. So thank you so much. Before we close, is there anything else you'd like to share? Any final thoughts, reflections, or words of encouragement to our listeners?
Well, I think that some final thoughts would be for the other sectors, because the health workers and the health professionals are the ones who are going to receive the malnutrition conditions and the malaria, the dengue, and the consequences of the structural situations in the world. But what about the other sectors? We need to work together. My final words would be for that, for calling to the other sectors also to think about health and about the health of the planet in this new challenge and this new era.
That's a great reminder, Carol. Thank you so much, to think that it's not just the health sector who usually is the receiver of the issues that are due to structural issues, but that we need to work together across the sectors. And so, Carol, Once again, thank you so much. And thanks to our listeners today for joining the Alliance Lift. If you've enjoyed this episode, please share it with others in your network, especially those working in health policy and systems research. You can also join the Alliance Alumni Network on LinkedIn to stay connected to hear more stories like this and be part of the growing HPSR communities. Until next time, take care and keep doing the work that lifts others too.